You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you for joining me and listening to the podcast. I like to share my years of experience as a holistic dentist. I have been graduated since 1992 and I own my own practice in Brisbane called Evolve Dental. If you want to know more, you can hop on over to holisticdentistbrisbane.au. But for now, let's get in the zone. Today, I'm going to talk to you about receding gums, what causes gums to recede and how you can stop it from happening. Because it's important that we protect your teeth and gums if you're going to have a healthy smile for life. So let's look at receding gums. When it comes to gum recession, there is a lot of misinformation and misunderstandings out there in the internet land, and even in the way that us dentists have been taught on this topic itself. So depending on what you read or who you're speaking to, the information can be confusing, it can be contradictory, and some of it will tell you that you can even grow your gums back and others say you can't. And then it comes to the causes of your gums. Are you brushing too hard? Or is it because you have gum disease? But is there more to receding gums than that? I am going to help dispel those myths around the receding gums and offer support on how best to address gum recession to stop it progressing and making sure it doesn't get worse in your mouth. So to understand why your gums recede, it's important to know a little bit about the anatomy and physiology of what's behind it. So let's look at what makes up your gums, shall we? So the gum anatomy basics. Your gums are really nothing more than a layer of skin over the bone that sits around your teeth and jaws. And the gum tissue will stay strong and high on your teeth as long as the underlying jawbone is intact and healthy. In other words, gum recession is going to occur if the bone that supports the gum tissue is withdrawn or it is damaged or destroyed. And that can happen due to inflammation, infection, or trauma. So the answer, in part anyway, to what causes gum recession is figuring out what are the main factors that are causing the jawbone height to diminish. There are really four main causes of this change in jawbone height, and these four main factors that cause the jawbones to shrink or demineralize are: number one, periodontal disease. This is an advanced gum disease. 2, bruxism, what's called clenching and grinding your teeth. 3, trauma, and 4, genetics. And today I'm not going to discuss around the nutritional factor. I'm going to be looking very more at the jaw itself and not general nutritional deficiency, which can also play a role in the process. In a healthy mouth, we have jaw around all sides of our teeth, like a sleeve covering our arm all the way up to our wrist. However, in some people, this covering of bone is not an even thickness on all sides. And often the layer of the bone on the outer lip or the cheek side, that can be very, very thin or even non-existent for some people. And this thinness of jawbone tissue on the outer side of our teeth plays a very key role in understanding what causes gum recession. So, getting long in the tooth. What causes this process? What causes the loss or demineralization of the jawbone? Now, it doesn't happen overnight. The bone becomes demineralized first, but the overall structure of the bone remains intact. So as long as the scaffold of the jawbone is still there and it's still in place, that can remineralize, assuming the cause has been effectively addressed. However, once that scaffold-like structure of the bone starts to demineralize, the gum tissue has nothing to support it, and it has no structure to remain high and tight around your teeth. And interestingly, this bone loss does not immediately cause the gum to recede. At this point, the gum tissue is very vulnerable to recession. So without the underlying support of the bone to keep it in place, any aggravation to the gum can provoke it to recede. It is at this point, when the underlying bone has diminished, that things like brushing too hard or incorrectly can most definitely cause gum recession to occur, but it's not the reason, it's a factor. So how do we stop gum recession? Well, to stop the gums from receding, we've got to first identify what's causing the underlying bone to shrink and demineralize. So let's have a look at these reasons. Gum disease. Now, gum disease is so incredibly common in our modern times, it's worthwhile to assume that you have an active infection and gum disease until it's been told you haven't. Now, recent research in the dental journals state that 50% of 30-year-olds and over 70% of 50-year-olds have periodontal disease. And periodontal disease is gum disease that has advanced to the point where the jawbone is being compromised and destroyed by bacterial infection and inflammation. The bad bugs in gum disease not only directly destroy the bone tissue, but they also cause our immune system to go into full red alert. And in an attempt to stop the infection, our defense mechanisms, our immune system, it creates inflammation. And it creates this inflammation locally in the gums. Now, the problem is when this inflammation and infection is chronic, you get chronic inflammation, which contributes to the breakdown of the jawbone health. So if you have bleeding gums, bad breath, sore gums, receding gums, loose teeth, or teeth that are drifting or moving out of position, then you must get your gum health properly assessed and treated by a dental professional, because these are common signs of gum and periodontal diseases. Bruxism. That's the proper name for teeth clenching and grinding. Research shows that the cause of teeth clenching and grinding, and is bringing it to light and allowing our profession and people to understand more about why people grind their teeth and what we think about it is incorrect. We think it's down to the stresses of modern day life, and that may play a role, but we're finding more and more that nighttime grinding is strongly related to sleep apnea. If you grind your teeth, you owe it to yourself to find more about this connection between teeth grinding and airways and airway difficulties, because this is now becoming very big in dentistry. So whatever the cause of your bruxism, it's clear that if you habitually clench and grind the teeth, it's going to lead to a breakdown in the strength and the structure of the surrounding jaws. How is that? Well, imagine rocking a fence post from side to side on a regular basis. Eventually the soil opens up around the fence post and it gets loose. Now, if we apply that analogy to clenching and grinding your teeth night after night, your teeth rock in their bone socket. That leads to bone loss, bone damage, and gum recession. Trauma. It goes to say that you don't want to get hit in the mouth. You don't want to be smacking your teeth and your faces into things. It hurts. And the trauma of that one accident can literally cause irreversible lifelong damage. Gums and teeth like to be massaged gently with your toothbrush. They like to be stimulated and not smashed around. So don't brush too hard or carelessly. If you want to protect your gum structure, you've got to treat it gently. Genetics. Okay, so the thickness of the facial, the outer jawbone, that may be a matter of genetics, just like we're born with variations like thick skull bones, fine or thick hair, or how thin your jawbone is may have a genetic underlying component. Some people may even be born with a complete lack of bone structure on that gum surface on the facial side and have gum over the tooth only. So when this area of jawbone diminishes, the gum tissue that was being supported becomes very at risk of recession. So can you regrow the gum tissue that you've already lost? Well, currently, to my knowledge, once that gum tissue has receded, that means that the bone has gone, and once that's happened, your gums cannot grow back. They can only stay where they're at. They cannot come higher up. Yes, the bone tissue can reharden, but my understanding is it doesn't regrow. It doesn't come back to its original height. And hence you can't regrow the gum because there's nothing to support it on, nothing for it to grow back over. The good news is that the bone tissue can reharden, it can strengthen. So if you've got loose teeth, which is a very common sign of advancing gum disease, by taking care of the problem, it will allow the jaw to remineralise and strengthen, and your teeth can tighten back up in your mouth. So now that you understand the real causes of gum recession, it makes sense that we want to take the steps to support optimal bone remineralisation. So we've talked about what causes the gums to recede and what to look out for and what's actually going on below the surface. So now we need to shift into supporting you to better understand what you can do about gum recession, what things you can do at home that doesn't involve necessarily a trip to the dentist to improve on that mineral and nutritional component that I've touched upon. How to stop receding gums. Now, gum recession can only really happen when the underlying bone tissue of the upper and lower jaw has diminished through the process of demineralization, which gets caused by gum disease, teeth clenching, and/or trauma. In this video, I'm going to explain to you the ways that we can deal with this through nutrition. So we can optimize maintaining the bone density in the jaws, as well as how we can actually rebuild bone tissue that has been demineralized. Now, can receding gums grow back? That's something I get asked a lot. And look, to the best of my knowledge, once the gum tissue has receded, it will not regrow back up to the height on the tooth that it was before. Now, that doesn't suggest that we can't strengthen our jaw bones, which we can. We can stop further recession, or that our teeth are going to become looser. And that is the number one reason that adults lose teeth, is through gum disease. So gum tissue can only recede once the underlying bone has pulled back. Now, we can remineralize this bone tissue, but only within the current structure of what's there, what's still intact. So how do we support optimal bone density and remineralization? So I've been reading some research papers about the topic of gum recession. Ones like gingival inflammation, bacterial infection, alveolar bone destruction, and subsequent tooth loss. And these are characteristic features of periodontal disease, but the precise mechanisms of bone loss are poorly understood. Yes, that means we don't really know how the bone disappears. It isn't clear what's really going on, and therefore it's harder to provide answers and solutions. But there are some ways we can stop your gums receding. And here's what the current dental science knows, and hence some of the solutions that are currently on offer to stop your gums receding further. So number one, we need to stop gum disease. This is kind of self-evident, but it's worth stating. In order to have any hope of rebuilding the bone tissue in the jaws, we need to make sure that the number one cause of bone loss in adults, advanced gum disease or periodontitis, isn't continuing to undermine your oral health. I'm not about eradicating all the bad bacteria, but you do need to understand what conditions allow those disease-causing bugs to live and thrive, so you can ideally disrupt and disorganize their efforts to destroy your body. A great place to start is good oral hygiene, knowing you need to brush your teeth, you need to reduce gum disease, why brushing is so important, and how to do it and how to floss effectively, and what sequence you do them in to have the best oral hygiene habits. These are excellent steps to increasing your knowledge of how to get rid of those bad bugs and treat your gum disease. Number two, what about jaw exercises? Can they prevent receding gums? Now, if we look at our current Western diet, it consists of many soft and pappy and processed foods that don't require a lot of chewing. So could this lack of fibre in our diet causing functional loss in our oral health? Now, if we eat a diet that lacks nutrition, then we're going to get problems with our health and dental issues. I mean, it's going to decline. And it may not be so obvious, But what about the texture and the chewability factor of the foods we consume? This may also have a part to play in strengthening our jawbone and our gums. So if we're only eating soft processed foods, is this weakening our jawbones? Here I'm talking about the physical action of chewing on foods that require that we actually chew them to break them down. And this action of chewing activates the use it or lose it principle. So the bone density in our jaws, or anywhere else in the body for that matter, will diminish if we don't put stress and demand on them. This is why weight-bearing exercises are so essential to reduce the risk of developing osteoporosis. And I think the same can be said to be true for the bones in our jaws. The body has this intelligence where it will conserve and be thrifty. So if it senses that the bones in your jaw aren't being stressed and challenged enough, then it's going to shunt the minerals that it thinks you don't need from the area to another that has a greater need for bone building minerals. So we want to be sure to gently yet persistently and regularly challenge our bodies, whether it's working out to stress the bones to avoid osteoporosis and maintain our muscle mass, or challenging our mental faculties with, memory games or crossword puzzles to get our cognitive function nice and strong. The body grows stronger when it's gently challenged. So let's look at some jaw gym solutions for strong teeth and jaws. Well, any food that you really have to dig in and chew is a great workout for your jawbone density. Something like an organic meat jerky that's, a good workout that provides a good source of quality nutrition at the same time. Something else I could think of would be like raw parsley, a good mouthful of that, has loads of nutrition, lots of fibre, get a really good jaw workout. So the key takeaway here is to have a mouthful of nutritious food that requires you to chew strongly on it for several chews before it softens. And this is going to give you a good jaw workout that's going to encourage preservation of the jawbone height and density. 3, let's look at stopping gum recession with nutrition. Nutrition is a major, perhaps the most important component for optimal oral health. Ideally, it's better for us to get our nutrition from real foods rather than taking supplements. But the bottom line is, we can't make food better than nature. However, there is merit in knowing what nutrients play a role in this bone density process. It goes without saying that calcium and phosphorus are very important nutrients for maintaining healthy jawbones. However, research clearly shows that there are many other factors involved, including vitamin D, which is responsible for actually absorbing the calcium from your digestive tract and the foods you eat. Without vitamin D, the calcium that you get from your foods or supplements just can't be used by your body. Vitamin K2. This transports calcium in your body to the bones to where it's needed. Some studies suggest that large amounts of vitamin K2 may increase bone density in people with osteoporosis. It's worth looking into. Vitamin C promotes the production of collagen and also the osteoblasts, the cells that form new bone. Most people with osteoporosis are likely to be vitamin C deficient, by the way. Let's look at magnesium. Magnesium helps transport calcium to the bones and assists the absorption process of calcium. Zinc manages the secretion of a hormone called calcitonin, which regulates calcium levels in your cells and also is important for bone development. Boron. This works like vitamin D because it improves your body's absorption of calcium and magnesium as well. Strontium. This is used to improve your bone density, which is critical to your overall bone health. In general, we are nutrient deficient. Yes, even if you are eating what you consider to be a really, really good diet. The fact remains that our soils have been so damaged by, over the past 75 years, from the sort of farming that we do, treating a biological medium as though it's only made of chemicals, and using petroleum-based fertilizers, pesticides and herbicides has damaged our soils. So unless you're getting your foods from something like, an idyllic farm that's been biodynamic for over 50 years, you're probably dealing with some levels of nutrient deficiency. Of particular concern is the loss of trace minerals from the soils. Modern farming practices have created this, so we're all deficient to one extent or another. So knowing what foods to eat is only part one of the battle. We've also got to understand what foods damage or undermine our oral health. And so these are some foods to avoid if you want to optimize your bone health. Knowing what foods diminish our nutrient uptake is really important if we're going to have good bone health. An anti-common nutrient is a thing called phytic acid, and this is found in grains, beans, nuts and seed. Phytic acid or phytate inhibits the absorption of several minerals, including iron and zinc. And that means that even if you're eating enough specific mineral-based foods, your body might not be able to use all the nutrition. You are what you absorb from what you eat. To lower the phytic acid of the foods we've talked about, either avoid them or use special prep techniques like soaking and sprouting, which are supposed to deactivate the phytic acids present in the nuts, seeds and beans. We must talk about sugar, the white poison. Sugar disrupts the balance of our blood chemistry, which directly interferes with our body's ability to optimally be well. Sugar suppresses our hunger for real food, so it can cause us to miss the opportunity to nourish our health with foods that actually give us the nutrition necessary to thrive. I can hear you, but don't our brains run on glucose? Don't we need to at least eat some sugar, Dr. Rachel? No. In fact, experts argue that the body functions metabolically much better and cleaner and more efficiently using fats for energy rather than sugar. So sorry, the truth is we don't need to eat any sugar. Our body can produce enough energy from other sources. Sugar is also pro-inflammatory and will increase the amount of bad, harmful bacteria in your mouth. Both are going to make it more likely for you to develop or accelerate gum recession and not stop it. I hope this information on how to stop receding gums and to remineralize your jawbone helps you along your path to optimal oral health. If you're concerned about the health of your teeth or gums, then please give us a call to schedule a consultation and a full mouth health assessment today. Our number is 37201811, or you can email us info@holisticdentistry.au. I'm Dr. Rachel Hall. This is the Dental Zone podcast. Thank you so much for listening and joining me again this week. I trust that these hints and tips and information are empowering you to make better decisions for your health and well-being, as well as your oral health. And until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.